Tonight, doctors around Iowa are urging people to check their vaccine records. The state confirmed our first case of measles today. KCCI's Pepper Papura is live at Blaine Children's Hospital in Des Moines for us tonight. Pepper, the doctor you spoke with says he expected a case to show up here eventually.
That's correct, Ben. Now, the doctor we spoke with, as well as the hospital he works at, they're not the ones treating this case, but he does have experience treating measles outbreaks, which is why he wasn't surprised by this. So far in 2025, we have seen measles outbreaks all across the United States. Iowa is the 31st state to find a case. And in total, that's more than 1,000 cases across the country, and 3 of them resulted in death. So now that we do have a case confirmed in Iowa, he says there's several reasons why there could be a few more show up. Iowa's first confirmed case of a highly infectious virus since 2019.
Measles is not like regular viral infections. It's not like a regular virus causing a cold.
Could put a damper on Memorial Day weekend.
With travel over the Memorial Day weekend, with upcoming travel this summer, that has been something we have all been concerned about, is if measles keeps going on like it is, when we travel state to state in the summer, there's certainly a risk that we're going to come back with it.
The state health department says the case is in central Iowa, but did not specify a county or city. The department says it was discovered in an adult male who was not vaccinated for measles. Dr. Joel Waddell from Blaine Children's Hospital says the healthcare community has been preparing for a case in Iowa. Now that it's been discovered, they have one priority.
It is so highly contagious that we want to limit the number of secondary cases.
But vaccination rates in the state could make that challenging. According to the state health department, at least 95% of 2-year-olds in the state need to be vaccinated for measles to avoid an outbreak. Right now, that number is around 84%.
That is the perfect recipe for having a lot of children infected at the same time. And it is a perfect recipe for having this virus spread very quickly.
To protect yourself and your family, Dr. Waddell says to learn the telltale signs of measles.
You can tell very, very quickly when you walk into a room if a kid has measles or not. Kids with measles are absolutely miserable.
Look out for symptoms like fever, cough, red or watery eyes, a runny nose, and a rash like this one to show the signs of infection. He also says to check vaccine records. If you're unsure if you or your child is fully vaccinated for measles, contact your family doctor. And one more thing that Dr. Waddell says to keep in mind: call your doctor before showing up at their office if you do suspect that you or your child might have measles. If you show up in a waiting room, you could expose other people. Just call ahead, let them know the situations. They will find a way to make sure you are checked out safely. In Des Moines, Pepper Papura, KCCI 8 News, Iowa's news leader.
Yeah, sounds like a nasty virus, Pepper. Thank you. And it's not just Iowa dealing with it. According to the Centers for Disease Control, there have been 1,046 cases of measles so far this year. 96% of those were in unvaccinated people. That's around 1,004 cases, and 3 people have died. At least 30 states across the country have recorded at least 1 case of measles so far this year. KCCI will continue to track any cases of measles that are discovered in our state and ask the important questions to help keep you safe. Download our app and check our website for the latest information.